have cancer. Or people who are comfortable and confident can raise their hands. That will be easier to understand. Yes. So, yes, I got one response that I'm confident. Do you come across the relatives telling you not to tell the patient about the illness? The spouse or the mother or the father or the son, daughter, or sometimes even the neighbors come with the patient and tell that's not to tell the patient. We have not told. So they come first into the room and then they say, don't tell. And do you think we should tell the patient or we should not tell the patient? It is interesting to hear from any of you. Should we tell the patient when the caregiver insists that don't tell my mother that she has cancer?
Depends on how much patient wants to know.
Yes, it depends on how much. Again, that becomes tricky, right, Dr. Priya? Because when we ask, "Oh, do you want to know more about their illness?" Sometimes they say yes, but then the family member might have told you not to tell, and then we don't know how to proceed, whether we can tell or not, because the patient wants to know clearly, but we have a request from the family members not to tell. Anyone else? What do you think we should tell the patient? Should we actually tell about the diagnosis to the patient?
We have to tell, madam. At some point of time, they must know what is problem there, and so
Yes.
they can plan better.
Okay. So Dr. Shaida feels that we should tell so that they can plan better. Anyone else?
I also feel that the patient should know his prognosis so that he can prepare and we can prepare him for the end of life, whatever. Like,
Thank you, ma'am. Thank you for sharing. Anyone else who do not want to tell? I mean, that's fine. I'm just asking. People will have different opinions. Sometimes you really think patient need not know. That's absolutely fine.
When the patient's relative request not to share the diagnosis with the patient,
Mhm.
so they are thinking about something that we don't know. So
Yeah.
we have to ask the relatives what are the reasons behind that, and then talk to the relatives and try to find out for them to share with the patient.
Yes.
And then once they are ready, then we can share. We have to tell the patient, but we don't have to tell the right away. So
Okay. Anyone else?
Ma'am, I think a partial disclosure, step-by-step basis, I think would really help, because as Madam was suggesting, like they have to prepare for end of the life, and along with that, one should not forget about the legal formalities. There may be a will impending to write and all those things. So we should also consider the legal formalities that the person has to do, and also he has to convey the near ones, the dear ones, what all like it may be financial or non-financial things or any other things what he wants to convey. He has to convey or she has to convey. So that has to happen. So maybe not immediately on the first initial time we need not tell, but over a period of time, I think slowly we can tell about as he's understanding his symptoms, when he comes with the complaints. At that time, slowly, I think step by step we can disclose the disease what he is having and also the prognosis, and probably we can also help him with coping up with the disease.
Yeah. Thank you, Dr. Anand. Yes, we can wait for some time. It may not happen in the first sitting, probably. We'll have to take some time, but it is always, so everyone agrees that it is always better that the patient knows, because they can prepare, we can prepare. There is less communication gaps. We will know what the patient wants when the disease is progressing. So now, as Sripriya mentioned, we have a session specifically on how to communicate the bad news and how to deal with collusion. Collusion is when you collude with the family member to hide the truth from the patient. So if there's a situation like that, how to deal with collusion? A little bit we'll touch upon the anger. What if the patient is angry? Many a times when you tell the diagnosis, sometimes patients become so angry, they may just blast upon the nurses or the doctors. So in that situation, how can we deal the particular situation? It is just a sharing of what we do or what we have experience in. It may not be the best way or the only way, but we'll go on to the video lecture by Dr. Biju Raghavan, and then we'll come back and have a discussion based on that. Happy to get some comments from your side. Any comments from your side based on your experience in talking to patients? Does this work, the spikes protocol, or is it the same that you do in your practice? I'm happy to hear from you. Any comments or any questions, especially communicating the bad news or dealing with collusion? Is it anything different from what you already do in your practice? I hope there are no questions, and I'm not sure whether people are there because I can't see any comments or any questions after the session. And this is a very important topic that is covered every single module in the 8Com. So I'm sure you will all have experience in dealing with this session. Yeah, I can see at least a few chats that make sure that some people were listening, or at least you are there. Thank you so much for the chats. So we'll see you all tomorrow with, not tomorrow, yeah, tomorrow. So tomorrow we'll be starting with a few symptoms that we commonly come across in palliative care. Tomorrow we'll start with gastrointestinal symptoms. You might be already dealing with that on a day-to-day practice, but we'll talk about its special focus on palliative or supportive care management of gastrointestinal symptoms that we commonly come across. Thank you so much for being with us, and we'll see you all tomorrow for in the evening. I'm happy to take up a few questions if you have any, or you can send it in the WhatsApp. If you have any issues, any questions or comments in the communication. Thank you so much.
Thank you everyone for joining in. We'll see again tomorrow, same time. We do humbly request, we all know that you all might have had a very busy day, very busy schedule, but still, as Dr. Rajagopal said in the first session, it is really hard for everyone to keep watching blank screens. So please do try to log in with the videos on. See you tomorrow. Till then, it's Sripriya along with Mr. Rajagopal and Dr. Sreedevi Warrier. Sign off from the Tips. Take care. Bye bye.